Wash my hands real quick. Hello, Mr. Forbes. My name is Jody. I'm going to be your nurse practitioner student today. I'll be the one doing your evaluation. Is that okay?
Yes, ma'am.
Good. Well, I'm going to start off just by asking you a few questions. Can you tell me about why you came into the clinic?
Well, I'm getting on up there in years and just want to make sure my health is what it should be. Just want to get checked out.
Okay, well good. I'm glad you came in. Do you have any medical problems that you know of right now?
No.
Okay. Have you ever had any trouble breathing, any shortness of breath or chest tightness?
No, ma'am.
Okay. Have you ever had any trauma to the chest area or your heart or anything?
Got a torn pec muscle.
Okay. What about your surgical history? Have you ever had any surgical procedures?
No, ma'am.
Okay. Do you take any medications right now? Any prescription medicines?
No, ma'am.
So do you take any herbals or vitamins or any over-the-counter medications like aspirin, Tylenol, anything like that?
Some of those want to have a headache, ma'am.
Nothing on a consistent basis?
No, ma'am.
All right. Well, thank you so much for talking with me. I think we have a good history on you now. Do you have any questions for me at this point? Okay. I'm going to move on into the examination portion of your evaluation. I'm going to step out. If you could just take your shirt off for me. There's a drape behind you. Just drape that across you, and I'll be back to do your exam in just a few minutes, okay?
Okay.
All right. I got Mr. Forbes. Can I come in?
Yes, ma'am.
Okay. All right. First of all, I'm just going to kind of take this straight down and just look at your chest area. Sit up nice and straight for me. I'm just inspecting the chest area, noting the anatomical landmarks. It appears you've got good symmetry. Your color of your skin looks really good. I can see apical pulse here in the correct location at the fifth left intercostal space. I don't note any heaves or lifts on the inspection exam. If you could just lay back flat for me. Okay. I'm just going to kind of palpate your chest and feel for any abnormal vibrations or anything. Okay. If you could just sit back up for me. Okay. Sit up straight, and I'm going to palpate for the apex. All right. It's in the correct location at the fifth left intercostal space at the midclavicular line. The rate and rhythm is normal. Rate is around 65 beats per minute, and the rhythm is regular. I don't feel any vibrations or rubs or on palpation. I'm just going to take a listen to you, okay? Just breathe normal. Listen to the aortic area. The pulmonic area. I'm going to listen with the bell. I hear normal S1 and S2 sounds. I don't hear any extra heart sounds like an S3 or S4. I don't hear any splitting, which would be extra beats. I don't hear any clicks, snaps. I don't hear any pericardial friction rubs, and I don't hear any murmurs. So it sounds really good. The sternum borders appear to be in correct position. Angle of Lewis here is good, and I don't see any abnormal asymmetrical anatomy. So everything is sounding good and looking good with your heart so far. I'm going to go ahead, if you would, and listen to the herbs point. If you will, I'm going to let you lay back one more time for me and kind of roll over on your left side, and I'm going to listen at the herbs point for your apex of your heart. I'm going to listen with the bell. Okay, now we're going to move into the examination of the chest and lungs. If you could just fold your arms across your chest for me. I'm just inspecting for the anterior, posterior, and lateral ratio and diameter. Okay. You can put your hands down by your side for me. If you could just lay back, supine, and put your arms kind of out beside you. Okay. Breathing looks symmetrical. I'm noting the color again of the skin and on the hands. There's no clubbing. Capillary refill is good. There's no cyanosis around the face or mouth. I'm noting the anatomical landmarks. The suprasternal notch here is mid-sternal line. It's in alignment. Respirations are regular and unwavered. Easy respirations, not too deep, not too shallow. There's no use of accessory muscles. I'm going to just check your trachea real quick. There's no tugging or pulling on the trachea, and it is aligned with mid-sternum, and it's in appropriate position. The clavicles are even and symmetrical. The costal angle is appropriate. I don't know any barrel chest. I don't know any audible wheezing or stridors from where I am here. If you could just go ahead and lay back for me one more time. And just continue to breathe in and out regularly. I don't feel any crepitus or friction rubs on the chest. Okay, you can sit up. Just breathe in regular. I'm going to palpate the back of the chest. Respiratory rate is regular and normal at 16 breaths per minute. Okay, if you can lean your head forward for me and put your chin in, and I'm able to visualize C7 and T1. The spine appears symmetrical and midline. If you could turn facing the window and put your arms across your chest and lean forward just a little. I'm going to do percussion. Okay. If you could raise your arms above your head. Going to come and I'm going to percuss in the front.
Keep arms up.
Okay. You can put your arms down and turn back around. Percussion notes are resonant. I don't hear any hyper-resonance. They're loud in intensity, low in pitch, long in duration. If you will turn and face the window for me one more time, we're going to test for your thoracic expansion. So I'm just going to place my hands at the level of your 10th rib, and I just want you to breathe in for me. Breathe in. Good. Okay, I'm going to test your diaphragmatic excursion. I'm going to ask you to take a deep breath and hold it. So go ahead and do that. on your back where the tone changed to dullness from resonance. All right, let all your air out and hold your breath for me. Okay, we're going to do that again on the other side. Take a deep breath. I'm going to take a centimeter ruler and I'm going to measure the points between both of these lines. And it's even on both sides at 4 centimeters, and that's a normal diaphragmatic excursion between 3 and 5. I'm going to go ahead and listen to your breath sounds with the diaphragm of the stethoscope. Just breathe normal for me. Put your arms across your chest for me and turn and face the window. Just breathe in and out for me.
Deep breath.
Yes. Good. You can hold your arms up a little.
Overhead.
Take a deep breath in and out. I'm going to test for your vibrations called tactile frumitus. If you can, each time you feel me move my hands down, just say the word 99, okay?
99. 99. 99. 99.
Okay. Each time I move my stethoscope, say the word 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, thank you. You can turn around and face the front. I didn't hear any bronchophony, no agophony. Tactile frumitus seemed to be within normal limits. I didn't hear any breath sounds that were abnormal. I didn't hear any wheezes. I didn't hear stridor. I didn't hear any crackles or rails or rhonchi, which would indicate some sort of inflammation or mucus in your lungs. I heard appropriate breath sounds across all the lung fields. I heard vesicular sounds on all the healthy lung tissue, bronchial sounds over the trachea with no stridor, and I heard bronchiovesicular sounds in the bronchial tree area right up here in your chest. So it all sounds really good. Sounds like you're moving air quite well. So thank you for letting me do your evaluation. I'm going to step out and let you get your shirt on, and then I'll come back in and answer any questions you may have, okay?
Okay.
Knock knock, Mr. Forbes, are you ready?
Yes, ma'am.
I didn't have any abnormal findings on the exam. Everything looks really good, sounds really good. Your heart sounds strong. All of your valves sound like they're working properly. You haven't had any symptoms to warrant, any further testing at this time. And I think you're doing really well. Do you have any further questions for me?
No, I don't think so. I feel better
Okay.
about my future.
Okay, well good. Thank you so much for coming in today, and we'll see you again real soon for another checkup, okay?
Okay, thank you.
You're welcome.